DSW 2310, Dual Diagnosis, Treatment and Assessment, the Clinical Intervention Strategy, Chapter 4, and Classification in Psychiatry, Chapter 5, a Handbook on Dual Diagnosis, 4th edition. A 5-step systematic intervention strategy. 1. Gathering data. 2. Diagnosing. 3. Treatment. 4. Evaluation of treatment. 5. Modification of treatment based on evaluation. The team concept is crucial to providing appropriate care and treatment for persons with a dual diagnosis. Appropriate care and treatment requires and depends on the efforts of everyone. The team should include the person, family, advocates, direct support professionals, clinicians, professionals, etc. Everyone's contribution and insight must be valued. Gathering data. Must-haves include, see page 58 of text. Correct diagnosis depends on having complete and accurate information. Medical history from birth to present. Medication history, birth to present. Current and past health concerns. History of disability within the family. Etiology. Residential, educational, and vocational histories. Life stressors and crises, past and present. Identity orientation. Behavioral concerns. Previous treatments and outcomes. The more complete the information is, the more accurate the diagnosis. Person first and foremost. Whole person development includes emotional, interpersonal, professional, physical, wealth, environmental, and mental. Mental Health Consultation Form, Appendix 1. 5 assessment tools, a biographical timeline, a sleep chart, a behavioral incident chart, bipolar mood chart, psychotropic drug profile. Note: there are numerous other assessment tools which has advantages and disadvantages. This form was designed to be completed by direct support professionals or family who support the person. Diagnosing. Looking at patterns of symptoms. Feeling depressed, anger, crying, explosive, moody, confused. Diagnosing. Diagnosing mental health is a responsibility of a trained mental health professional, psychiatrist. Exercising caution. Symptoms associated with mental illness also could be caused by medical problems or medications. Mental health workers are often unaware of how mental health issues manifest themselves in persons with developmental disabilities. Direct support professionals know the individual with the developmental disability, are knowledgeable about mental illness, and assist in determining a diagnosis. Mental health staff know the full range of treatments and are flexible in providing treatment. Diagnosis is a matter of looking for patterns of symptoms. When working in consultation with a psychiatrist, the person was being treated for bipolar mood disorder discovered that when symptoms of parasites were treated, the symptoms of mania were alleviated. Comprehensive treatment. Use biopsychosocial model, medical care, exercise, nutrition, psychotherapy, behavior management, medication, etc. Use approaches specific to the person and diagnosis. Medication is not always necessary or warranted. Behavior management is not always necessary or warranted. Modified psychotherapy can be a treatment for some mental illnesses like depression, bipolar mood disorder, etc. Brainstorm treatment options. Treatments which are associated with the diagnosis. Evaluate the feasibility of treatment. Financial resources. Expertise to carry out treatment. Time to provide treatment. Access to skilled therapist. Does the physical or social environment support the treatment? Consider the person, past successful treatment, skills and health to participate in the treatment, are goals of treatment consistent with their personal goals. Goal is to find the resources to support the treatment, not to abandon the treatment. Ethical questions. Is the treatment ethical, valued, and moral? Were appropriate consents obtained? Is this a treatment used with people of all abilities? Is it the least restrictive alternative? Can the person increase or maintain skills? Does this enhance the person's quality of life? Evaluation of treatment. Important considerations. Keep accurate and complete records. Review data collected. Modify treatment based on data collection and effectiveness of treatment outcomes. Continue treatment until the person returns to a normal functioning state. Classification in Psychiatry, Chapter 5. Making a psychiatric diagnosis. How? Look at pattern of symptoms and match the pattern to a specific mental illness. Qualified, experienced clinicians can utilize the checklists and/or other diagnostic tools to confirm a diagnosis. Caution. A person can have more than one mental illness at a time. Mental illness can influence behavior. Diagnoses can overlap. Symptoms can overlap. Diagnostic and Statistical Manual of Mental Disorder, 5th edition, DSM-5, published in 2013, used mostly in Canada and the United States, assists professionals with diagnosing mental illness. Every mental illness must meet certain criteria and clinical features. It requires a complete case history, including biological, psychological, and social factors. Includes diagnoses which are due to medical conditions and substances, medications. Supports the biopsychosocial model of mental illness. Not a perfect diagnostic tool. It has received criticism, but it does provide a starting point. The end result is to improve the quality of life for the person. In 2007, NADD published the DMID, a diagnostic manual, Intellectual Disability, a textbook of diagnosis of mental disorders in persons with intellectual disability. Excellent resource for clinicians working with persons with dual diagnoses. NADD is currently developing the DMID to be consistent with the DSM-5. Outside of Canada and the United States, they use International Classification of Diseases, ICD. The World Health Organization is developing ICD-11 to be consistent with DSM-5 to increase consistency of diagnosis.